Welcome to the new ED at Community. This is the start of the new era at Community Medical Center. We're just completing phase 1 of our emergency room project, and it's exciting. It's exciting for us, but it's also exciting for our patients.
The entire emergency department is going to be renovated, but this phase 1 is the first step, provides additional beds for us so that we can take care of patients in a more timely way.
We completed a total of 35 private rooms within phase 1. At the end of 5 phases, we will have over 80 rooms that are all private treatment rooms. We will continue to go into phase 2, which will be a combination of our lobby area in addition to our fast track area.
The layout of this department allows for all team members to work together. There's doctors sitting next to nurses, sitting next to secretaries, sitting next to techs. Everybody works together as a team instead of separated in different sections of the department.
It's open so our staff can see the patients, but it also provides privacy. You can close the doors in case somebody is sick or somebody's infected. So it really protects the staff, it protects the patients, it protects all of the family members that come in here.
We have rooms that are adequately sized to where we could take better care of everybody, where families can stay with their relatives and family and friends as we go about taking care of their medical problems.
It's more modern, it's all up to date, everything is brand new. I think it's going to be uplifting for the nurses as well as the patients to come to a place that looks like this.